Hi, everyone. Welcome to this webinar. I'm Audrey L'Espérance. I'm Assistant Professor of Health and Social Service Management at the National School of Public Policy and Administration here in Montreal. I was, until last September, a Research Associate and a Scientific Manager at the Center of Excellence on Partnership with Patients and the Public. We are extremely happy to present the work we've been actually doing for the past 3 years with a great group of friends. But I would like to begin by acknowledging that I'm located on unceded Indigenous lands, and the Ginyongehaga Nation is recognized as the custodians of the lands and the waters surrounding me today. Janjaga is historically known as a gathering place of many First Nations, and I'm grateful to have a continued connection with the past, present, and future in our ongoing relationship with Indigenous and other peoples within the Montreal community. So I hope that wherever you are in Canada right now, you can acknowledge the land you are in. And I'm going to ask actually my colleague and friend, Eleonora Bogdanova, research assistant at the Center of Excellence on Partnership with Patients and the Public, to just give you a bit of information on how the Zoom platform is working today and how you can actually interact with the presentation, myself, and maybe ask questions and give comments during the presentation. So Eleonora, please, I'm letting you go.
Thank you, Audrey. Welcome to the official launch of the Learning Together Evaluation Framework for Patient and Public Engagement in Research. We're very happy to be with you today. Please know that you're welcome to use the chat box below to share your thoughts with us at any time during the presentation and comments as we go along. So we will have a presentation period followed by a time for discussion and questions. You're welcome to raise your hand at that time, at the question time, so we can discuss your questions out loud, or insert your questions in the Q&A box, below. Thank you.
Thank you, Eli. So the Learning Together Evaluation Framework has been conducted by a team at the Center of Excellence on Partnership with Patients and the Public in collaboration with the Canada Research Chair in partnership with patients in the communities. And it was funded in part by CIHR through a Catalyst grant for a one-year project that actually unfolded for the past 3 years. So you'll see there's been a few transformation of how and what this project became to be about. Just to give you a bit of an historical perspective on our work, we really, I think, everyone that really engaged patients and public members in their research projects and organized research organizations nowadays are asking that big question of how do we know that we're actually walking the walk, walking the talk of patient public engagement. And I think that what we want to completely avoid is this idea of instrumentalizing tokenism in patient engagement, and we want to achieve that partnership not just in the work we do, but in the transformation we want to actually build in the healthcare system. So the team worked, and I was happy to be part of a systematic review evaluation tools that was done in between 2016 and 17. So we had a good evaluation toolkit, but we really needed that blueprint. And I think that after the evaluation toolkit project, most of our collaborators and the team members came to that realization that without the blueprint, it was really hard to actually know what we were trying to build and evaluate eventually. So we gathered with many collaborators that I'm going to present in details a little later, but we developed this methodology, a three-phase methodology to gather as much of participants around the development of a Canadian evaluation framework for patient public engagement. It started with conversations and meetings about what we can do together, and we started talking and thinking about having as much as the deliberative methods as possible to develop a framework that would not only mean something for people, reflect the practices of patient engagement across Canada, but also, I think foster uptake from stakeholders. And so the first, I'd say, result of this project was to publish a protocol, because after many discussions, we ended up understanding pretty quickly that the framework would be, vastly Canadian, and because mostly SPORE funded entities and SPORE partners were involved in this this endeavor, this research endeavor, we knew that the transferability of the end product would be maybe limited in a way. However, we thought that the process to get to that evaluation framework, to the process of co-developing the framework, was in its sense one thing that could actually be easily transferable to other teams that were searching for ways to build their own evaluation framework. So that's one thing that we did early on in 2021, and we were really happy of publishing it in research involvement and engagement. The main objective of the project was to develop a national adaptable framework, and the two words are important here. National, because we wanted it to be representative of what is happening right now in Canada in the strategy for patient-oriented research community, but also adaptable to all of the different experiences of engagement that people actually are implementing across Canada. And we knew that project to project there are similarities, but that there are also very much a lot of differences in the context and also populations we are engaging. So in many ways, we wanted that adaptation or adaptability to be key here in the way we were building the project. This is our beautiful, beautiful research team. Very vast expertise, people from across Canada again. And we worked very closely with two patient partners. I think that Carolyn, I think I saw her name in the list of people today attending, but hi, Carolyn, if you hear me. Carolyn Canfield and Marianne Levasseur, who really worked closely every step of the way with us, co-designing questionnaires and co-analyzing with us, building the graphic design you'll see. So it was a shared, we discussed the presentation today together, and we decided that I would present, but I'm very much the voice of our research team here, and I'm really, I was really fortunate to work with these beautiful people, clever people, and it was challenging in some ways, in many ways, but transformative. And I think that the Learning Together title really is a reflection also of the process that we embarked on and actually lived through during this research project. Those are all our collaborators, and this project wouldn't have been possible without all the collaborators you see on this page. We ended up, collaborating with SPORE funded entities across Canada, SPORE networks, SPORE units, to identify key participants for this research, for all of the phases of the research, and the organizations were instrumental in informing our choices, our work, and also of reaching out to patient partners, researchers, patient engagement leads across Canada to help us recruit and also have diverse perspective as possible into our work. So it was a 3 phases project. The first phase was a consensus building exercise around the dimensions of evaluation. So what we asked questions to participants about what successful patient engagement looked like or felt like, and what type of transformation we were looking for. And it helped us build a logic model. Um, and then a second phase was a Delphi, where actually that helped us identify core process and outcome indicators. And throughout this process, so a third phase was kind of transversal to our work, was those experts working groups where that helped us, build in an equity lens into the work we did, and also, attach this the importance of adapting or having a framework that was as adaptable as possible. Across all 3 phases, it's 141 participants actually that participates in a way or another, sometimes being consulted through the Delphi questionnaires, sometimes participated to the 25 hours of consensus building exercise. So uh, and sometimes also, like, some people came in as experts in this work, and without those participants, without all of us gather, I don't think that we would have ended up with such a beautiful product, and I think a product that reflects the reality and the values of the Canadian patient engagement community. So we are immensely grateful for the collaboration, the commitment, the engagement. You'll see it was overwhelming how people were when they were saying yes to our invitations. They were actually saying yes for a long-term commitment, and whenever we were asking for help, most people said yes with pleasure, and they gave even more than what we expected. So thank you for any of you that who participated or helped us along the way. And there's this very we are, as a research team, really grateful for that. So phase one was a consensus building exercise on evaluation criteria and evaluation dimensions. And for us, it was important to mobilize the community around the project and also foster some common understanding about, what patient engagement should look like, what transformation we're thinking about, creating, and also generating ideas about what the logic model of the framework should look like. We used a nominal group technique, who's like a well-known methodology, and we were able to gather 42 participants across Canada, including territories, 24 of which are patient partners, 12 research research patient engagement experts, sorry, and 6 were researchers. However, within those 24 patient partners, you can actually count some people that had 2 hats. So people that were at the same time patient engagement experts and patient partners, or researchers and patient partners. It was interesting to see how people were self-identifying during that round of work. We had to turn our consensus building exercise, which was supposed to be done in Ottawa on a one-day basis, into a virtual event in April 2020. And you can already know why. So the pandemic hit and we needed it to reorganize. So we divided a group into 4 subgroups, and we conducted 11 virtual meetings. The first questions we were, one of the first questions we were asking was about those guiding principles that you can find in the patient engagement framework that SPORE published in 2014. Those 4 principles were inclusiveness, support, mutual respect, and co-building. And one of the first questions we asked was whether those were still relevant, whether we needed to redefine or reframe them, and finally, if anything needed to be added to those guiding principles. One thing, one message that came out clear was the fact that guiding principles are great, but they're not enough. They need to be actually supported, or a supporting structure to something more tangible. So that was understood loud and clear, I'd say, from the research team perspective, because this is what the research, the evaluation framework was trying to actually answer. But we also ended up redefining those guiding principles and adding some new ones. So we ended up with 7. The first one is relationship building, co-building, transparency, sustainability, support and barrier removal, equity, diversity, and inclusion, and impact and transformation. One thing that really came out also from the discussion was this the importance of understanding how patient engagement was a transformative mechanism for health research, but also for healthcare in general. Patient partners, but also researcher were saying that they are not engaging just for the sake of engaging or for the fun of it, but actually they were engaging for the sake of transforming people, practices, and systems. And in that way, it needed to be a guiding principle that was underlined very strongly. And you'll see that we gave it a special place in the framework, because I think that when we did the consensus building exercise, we were hearing that the community was interested in the process, but really wanted to know what it was changing, or whether it was changing the way we do research. And so this is the logic model that we built. Just by the way, it wasn't that pretty the first time we we ended up with lists of dimensions, and not this pretty graphic design first. But we ended up with I'd say 3 different phases of patient engagement, and 20 different dimensions. The first section you see on the model is this first line on the path up on the graphic design, and those are almost like dimensions of preparation to engagement. Recruitment, clarifying roles, following guidelines and policies, creating readiness in environments, planning for appreciation, co-designing the project. But then the real that you see in the middle, so this circle of elements where you see the process dimensions, actually, this is where actually the engagement happens. And one thing that came out of the consensus building exercise were that, yes, the elements are important, but there's this idea that there's no linearity in patient engagement, and we needed to show that in the model, that it's not about one thing after another, but mostly about being reflective and actually going back and forth into those mechanisms of good engagement. So refining your engagement and having a welcoming environment are things that are always to be improved along the way, and it's more of a snake and ladder type of process than something that would actually go from A to Z. And then the mountain you see on the graphic design are those types of transformation that we heard people talk about. But in this sense, one thing that came out of the consensus building exercise was this contributing effect of each of the dimensions. People were telling us that building capacity, you cannot transform practices, for instance, if you're not building capacities first, that refining research have nowhere to go if the people don't have, better practices of research, and so on and so forth. So it was important to show a path towards, greater, broader, optimal transformations. And so that's why when we worked with the graphic designer, we wanted that path to be, sinuous in a way, but at the same time, building these transformations along the line, along the way. The second phase of our project was at Delphi, and we wanted to identify key indicators for each evaluation dimension. So we knew that, within those broader dimensions, there were more indicators or elements that we need to observe and look for when we evaluate. We did a rapid literature review, but we were so fortunate because two systematic reviews were published just right before we did the work of the Delphi and co-constructing the questionnaire. So it was awesome to have those. And so those systematic reviews helped us identify the indicators and actually classify them underneath those bigger dimensions that we already had. However, the thing is, it's not because you have items that it necessarily becomes a questionnaire. And so we sat with Caroline and Marianne to co-construct and revise the terms, the wording, adding some key indicators to make it as close to the Canadian reality as possible. And so this work, just by the way, was planned to be done within 3 months, and we ended up doing it for almost a year. So just so going into this phase of co-construction was not something that we took lightly, and we ended up with a list of 170 items, which is a really long Delphi, really long questionnaire that we wanted to go and conduct online. But we also, made sure to go and validate the questionnaire with all of our experts working group, trying to figure out the best ways and the most simple ways to convey those items and show why they were important. For each items, the rating scale was from 1 star to 5 star. And we add a qualitative box for each section of the questionnaire. We recruited 187 individuals through the SPORE support units and SPORE networks across Canada. They helped us identify these people. They gathered initial consent to share their contact info with our team, and then we invited them to answer our Delphi directly. From that group, 98 people completed round 1 and 78 completed round 2, which means 80% retention level, which is overwhelmingly great. Usually, and we've looked into the literature, and usually if we're happy if it's over 50% retention. So you can see the level of engagement, even if the questionnaire was long, even if it was taking time for each individual to really do it all across. 80% of people really helped us gather information. I'm going to leave you a few details on the methodology and how we analyze. And if you're interested, we can totally go to that during the Q&A. But for each element, each big dimensions, we included some some items, we excluded some items, and we identified the most important items, which you will see are indicated as stars in the model. So I'm just gonna stop this sharing, and I'm gonna show you the interactive model, which is right here. And by the way, it's available online in French and in English. You have the interactive version, which is the one I'm presenting to you right now. And there's a more static one with the list of indicators and dimensions that you can download too. So it's all available open access for you. So if you click on each element on the model, you have lists of indicators that will appear like that. These lists of indicators are identified with stars and plus signs. So throughout the questionnaire, people gave us an understanding of which item they thought were the most important. And in Adelphi, we define a threshold of what will be included or excluded within the model. And we ended up having, a lot of items, many items that were scored very highly, but we saw some items kind of, be even more important for the group as others. So the stars are must-haves. So there are indicators that participants told us were, the most important. So 90% of people gave 4 or 5 stars to those indicators, those items. For plus signs, it's actually this section between 75% and 90%. So you see, it's still very important for participants, but it's a little less important. And when we were analyzing which one made the cut and which one didn't, we ended up seeing that there's maybe a process of creating capacities for evaluation within our organizations, within our project teams. And if I would use the model, I would actually choose within the must-have first, and then try to see whether we have the capacity to collect data for other types of items afterwards. It's kind of nice to have all of these elements. But if you look at the 20 dimensions and the list of indicators, it ends up like a really big project to evaluate every one of them. So the idea is to choose, and the star system and the plus sign system are there to help you, try to create this evolution in the way you evaluate. The plus signs are also sometimes most indicated for some projects versus others. This is where we're building some adaptability here, and so it's not necessarily, you don't necessarily have to use the whole framework every time you want to evaluate. Another thing that came out of the Delphi, and I think this was helpful to also in building the framework, is that we ended up, giving you items that are not indicators of that are indicators showing you what to look for, but not necessarily how to gather the data. And by discussing with the research team and with expert working groups, and some collaborators, we ended up seeing that the adaptability piece was very much attached to the methodologies to capture those indicators. Some projects are evaluate for different, actually all projects evaluate for different reasons, for different purposes, and then that needed to be weighed in finding the best methodologies to gather data. For instance, one item could actually very easily be captured through a qualitative in a qualitative way or quantitative way, and you'll need to sit down with your team and decide which makes more sense to the nature of your own engagement. In research terms, you need to align your ontology and your methodology, so the nature of your partnership with the methods you're going to be using. And that is not something that we are prescribing for you. It's something that your team needs to actually decide and show. So you can, I'm not going to navigate each and every list with you. It would be too long. I think you can do that by yourself. But there are a few surprises, I'd say, within when we analyze the Delphi. And one I can already tell you is that idea of readiness. So within the list of readiness to engage elements, the only three items that came out were actually very much about training researchers on patient engagement and patient partnership, creating some confidence in partners and confidence that there is a commitment to research partnership, confidence that everyone is well prepared for that partnership to happen. It's very much about perception, but also about self-efficacy. So patient partners didn't think that they needed training to embark in patient engagement. It was more about researchers to train themselves initially. And then we saw within supporting that, offering orientation, training, support during and prior, during the project became more important for patient partners afterwards or during. So it's more an adapted support or an adapted training to the needs of each and every individual, each and every partner. So that can actually inform the things we do as sport units, sport networks, as research teams, way more, not just to evaluate it better, but also for the purpose of planning it better. Another thing that came a bit surprising to us was, well, for me maybe even more, was when within those practices, research, or those transformations, sorry, one indicator that got excluded from our by our participants was one about the burden of patient engagement. So we were hearing, and it was part of the literature review, that some indicators of transformation or effective patient engagement would be actually that it creates more, burden in terms of time or resources. It could cost something or takes more time, and that we would want to have kind of information about that when we conduct patient engagement, patient-oriented research. Interestingly, those were reformulated for more clarity from questionnaire 1 to round 2, and even so, they were completely excluded by our participants, saying that they were not as important as others. For me, it was surprising because that was something that was actually very dominant in some of the conversation that I was having at the time. So it's something that we'll need to figure out, like whether it's just that participants didn't want to, didn't really consider it an issue, maybe, that we need to actually go about patient engagement without thinking necessarily about these things, or there are maybe other reasons underneath, and we need to actually talk more and get to understand why. Yeah, I'm just gonna stop sharing, start again. So this is our the framework. We worked on the graphic design quite a bit. As you can see, that was, I still remember the first day that Marianne Levasseur came with our first draft of their logic model, and it was not that way at all, but it's still very interesting for me to see how even this boxy first draft is still represented in many ways in this final graphic design. We worked with the team at Fuselight, and they were extraordinary in capturing, what we wanted to convey and what the results were about. And we're really happy to provide it, open access on the Center of Excellence website. So I'm going to let you navigate each and every elements, but for the next few minutes we have, we're going to take questions, and I'm going to try to answer anything you put in the chat on our Q&R. Eleonora is going to help me. So thank you for your interest. Thank you for being here. It's great to see that many people interested in the evaluation of patient engagement, and I'd be happy to share more.
Thank you, Audrey. We already have a few questions in the Q&A. So while we wait for others to put their virtual hands up, I could start with the first one. Somebody from the Canadian PCR network asks if this framework is geared towards research project and teams, and if so, can it potentially be adapted to research networks?
Yeah, it's a very important question. I didn't mention it, so thanks for asking. It was built for the project level evaluation. However, while working on it, and we have a different research project with a colleague of mine, Davina Banner-Lucaris, who looks at specifically research networks and how we can evaluate at a research network. It's linked to this project and in very many ways. But while working on the two at the same time, I got to understand how actually the first structure, so every element of preparedness, those dimensions about recruiting diverse perspective and including diverse perspectives, clarifying roles, having good policies and guidelines, providing preparedness, helping for co-design, and planning for appreciation. All of these elements actually, that is where networks have a lot, and organizations have a lot of responsibilities in building those engagement ready environments. And I think that when we'll try to think about an evaluation network, an evaluation framework specifically for organizations and network, Davina and I and the team, we're going to be thinking about how we can embed those two together, because they are linked in many ways. And so thank you for the question. And no, it's not necessarily specifically for research networks, but I think that if you look at it from your lens and the work you do, you'll see elements that actually you have in your hand and in your mandate as research networks to build capable engagement capable environments. And that means, providing, the support when it's needed, the trainings, initial training for researchers, elements that you can actually see in this specific framework for project purposes, but actually where you can be a very big lever of creating, providing the right environment. I hope this answers your question.
Thank you, Audrey. We have a comment from Lindsay about patient partners and training, actually, about patient partners saying, but I think you mentioned that in the description of the framework and how it was built. Lindsay asks, were the patient partners already well versed in the systems and processes of research? I often find that those denied the most access to research systems often need the most support and training to be able to access POR.
Yeah, that was interesting because that's a discussion we had specifically um, at first round, at the first phase of the project. That actually was also um, um, addressed through some of the elements of the Delphi. And one thing that came out of the discussions and also the qualitative analysis with the Delphi is that um, actually this can be a barrier to engagement if we create a necessity for training when we embark in engaging, and people wanted to be as inclusive as possible, and it's not about whether patient partners need to be trained to engage, but mostly for researchers to go towards and closer to the patient partners that are more vulnerable or have literacy challenges. For instance, we had a specific working group on health literacy, by the way, and that was very interesting to see that it's not the work of the patients and the communities to come to us. It's actually us that needs to do work to come to their places and their communities. So, and that's actually what is reflected in the framework. And I think that is a message that we need us to show. And then when the engagement's happening, when the project's ongoing, if there are some needs, sometimes they are very specific to the person, very specific to the project, or very specific to the theme of the research. So it's not something that's a one size fits all, and that's why we didn't want to, create an item or put an item in the framework that would kind of be restricted for projects and for research teams. And I hope this answer also your question.
Thank you. Eshere Choduri, sorry if I'm mispronouncing your name, asked, could you please share an example of some activity focused on the guiding principle about removal of barriers,
Yeah.
particularly within the EDI lens?
Yeah. So a lot of people during the consensus building exercise, and it was kind of validated through the Delphi, talked about trauma-informed approaches and how that needs to be put in place within the research team, but also in on global, more larger environments. Um, and uh, and a lot of people talked about the importance of having a flexibility on how we conduct meetings, how we actually go about the partnership, and that's in the refining partnership element on the framework, but also in many other items along the way. You'll see that the removal of barriers is it's encompassed in many elements of creating conversations, um, and creating space for feedback, and also making sure there is responsiveness by the research team in uh, lifting those barriers. And barriers are, again, specific to who you are engaging with, what is the team or the subject of your research, and with what kind of what is the community you work with. And that was also something we worked a lot closely with expert working groups in formulating the items, so it's not too restrictive, but it's still something that everyone will know what it's about. So it's clear, but not restrictive. So trauma-informed approach, broad term, but it means things that are very specific if you look into the concept and the methods that come with it.
We have a very interesting question in the chat.
Yeah.
Under partnership guidelines in the framework, could you elaborate on the difference between funding opportunities for patient partnership and funding opportunities to support patient partnership?
So funding opportunities for patient partnership are like those catalyst grants or those programs that are dedicated to bringing people together and building those partnerships. And then, funding for supporting or funding for, let's say, like support units or any staff and resources across our organization. And it means also in the project, at the project level, it can mean having a liaison person within the team. Sorry, I'm going to give you a very tangible, example, but Eleonora was that liaison person for each and every participants in the study. Whenever we had a patient partner or even a researcher or a participant that needed to have more information, needed to have a call with the team members, wanted to know if they were doing the right thing, wanted to, communicate with us. Eleonora was that person. They knew about her, they knew her telephone number, they knew her email, and she was responsive and very quickly giving them what they need. And I think in when we talk about lifting barriers, I think that's another thing. But it takes resources to have people like Eleonora in a research team. It takes resources that are sometimes not well funded in project fundings or not well thought through by funding agencies. So I think that's what came through in those items. The interesting thing also with those elements are that it has I'd say a larger effect on it has a larger effect on the message that this frameworks brings to the sport community. It's not just about projects or project manager or research teams. They cannot create funding programs. However, if they apply to funding programs, that's something that that needs to be evaluated. We need to know whether it is feasible to do good engagement without or with funding specific to engagement and without or with people or resources dedicated to supporting a partnership during. And I think that's something we don't know right now, or we tend to think it goes by saying that it comes along, but it's not necessarily the case. And that's very important, and that's a message that we can actually bring to funders too. I hope this is clear, but that's a really good question.
We have a comment about this framework actually being a measurement tool and a planning tool that can be used by all groups participating in patient engagement.
Yeah, and that's very important. And that's something that's an unexpected outcome of this project, is that we were building an evaluation framework. I've always said and thought that evaluation needs to come, way before the end of a project. It needs to be actually built in the project and planned for right from the get-go. But I really think that the framework can help people plan for good engagement and also recognize those mechanisms along the way. If you know about including, communicating, and what it means and what are those items, you'll be more, aware of them during, and you'll be able to actually not just report back on them, but also, reflect and improve along the way. And I think that this is an important element, is that if you want to plan for good engagement, you might want to use and look at the framework for that purpose, and just like try to figure out if you actually touched every element or most of elements, and keep it before your eyes when you're in it, so you might be more reflexive about your actions and your practices. The other thing we're trying to do, and it's not me, but specifically the team at the Center of Excellence that will actually probably um, conduct that work, but we're trying to build in all of the resources we know about that are connected to, for instance, we have great articles that were published in the last 2 or 3 years about appreciation compensation, how to have the conversation, how to build a good policy, an inclusive one. Well, those we'll try to embed those within the framework. So if you're actually looking for them, you'll actually see them a bit like a pathway that you can follow. We're trying to provide that at one point. I think that's another thing that came out of our discussions with collaborators along the way.
We have a question from an anonymous spectator. This is fantastic work. How do you see this framework supporting advocacy around system and culture change, i.e. getting more funding to support patient partnership?
So by the way, so I've been, because this work has been funded by CIHR, and that CIHR knows, and the SPOR units and networks have been super, almost like our cheerleader all the way. They were there from the get-go. They pushed for this project to happen. They also spoke about the project when we were conducting it. I'm on 2 committees of CIHR, one for the evaluation of SPOR, first version of SPOR, and now the performance review for next phase of SPOR funding. So I think that there's something there, the way we actually look into, what is performance, and patient-oriented research needs to be informed by this. So that's a small element. For funding, it's harder. I think that this is where there are still a lot of awareness to be to raise about the importance of patient engagement, what it brings to research, what it brings to research environments like networks or or even provincial communities of research. And I think also the evaluation framework can be useful in building the knowledge about patient engagement. We've always been, Antoine Boivin, who's co-researcher on this project, and I were very vocal since 2016 about the fact that if we don't evaluate, we won't ever be able to show, what are the effects of patient partners work on projects, but are also on research more globally. And without that, we won't be able to advocate for more, not just for more money, but also for more recognition that the work is important and has important building important transformation.
We have a few comments about the framework, and there's a lot of positive things coming in through the chat and the box, the question box. There is another anonymous spectator asking what's the publication plan for this work and other knowledge translation for this work?
Okay, so it's it's maybe the first time I see a team, and I think it's because it's the Center of Excellence team that actually provides the tool and the results through a usable, applicable tool before we get an article published. So the protocol was published, but we're working on the Delphi reporting and the consensus building exercise reporting right now for specific publications. So there will be 2 forthcoming publications for sure. I cannot tell you when, because we really put a lot of time and concentration on providing people and collaborators with the tool, because that's the useful part, I think. But for knowledge translation, there's more. So the center, the CEPPP is dedicated to supporting also, and every every member of the team right now is able to use and help you use the framework and support you in the use of that framework for your projects, but also for planning purposes through the work we do with the Quebec Spore units. Second, as a researcher, I'm still, carrying this work with me and with the team and trying to figure out like what we will do next, because I think a lot of people are asking us what are we doing next, and I think that this work is just the beginning of something that can actually be bigger, be broader. We could pilot some evaluations with the framework. So there are many possibilities, and we're actually, for us, knowledge translation is embedded in finding out what our collaborators are ready to do next.
We have a few minutes left. Iris Carey is asking, curious to hear your perspectives on engaging patient groups in research as a potential way to improve the sustainability of partnerships, as well as a way to access broader networks of patients.
I think that that's something that actually I learned and from the two patient partners that were on our team. So Carolyn and Marianne really made me realize the importance of the network of patients and the communities that are built through and because of engagement activities that are more project centered, and how that is also conductive to better research project and research partnerships. Afterwards, there's this reinforcing wheel of the community, of the relationships. And I think that this is where the principles are so important. When you look at relationship building, well, it's this reinforcing loop within the framework. Some indicators on their own are interesting, but in their consecutive, almost domino effect, are even more important to look for and to look at. Just to make a link with a previous comment, this is a comment also that was brought by a patient partner at the community, the evaluation committee for SPORE, that actually there is a community of patient partners that was built because of SPORE in a way, and it's a contributing factor for sure, but it's an important one. And the community is now, leading other projects and building more knowledge about engagement in Canada. And it's also a mechanism for more sustainability. The more we'll have patient partners pushing researchers and research organization to do more and to do better, I think that the transformation lies there. So thanks for that comment. That's really important too.
In the same train of thoughts, we have time for one final question from Brenda Andreas. How do you see the study supporting the health system itself from the learning health system lens?
That's a big question. The funny thing, we did a prior presentation and someone told me, like, why isn't health, the health of the population the endpoint? And actually it's transforming and improving systems, the endpoint of this research framework. And it builds in that question about the transferability between research and health care, which is, a continuum in a way, but how can we transfer it? Is it the same? Are transformations different? Is there, a contributing effect on other elements that were not touched because we were concentrated on research? These are all really good questions. I don't have answers, but I definitely think that there's really a link to be made. And by the way, in the dimension called improving systems, you have a line for learning health system. So participants considered that that more learning health systems should be built through and because of patient engagement. So that's maybe one piece that's not my answer, it's the participants' answer, but yeah, I think it's linked. It's just a matter of finding how exactly.
Thank you very much, Audrey. Thank you to all of you for being among us today. It was a pleasure to share this hour with you. We are at 2 p.m.
Thank you for your time and for your interest. And I'm gonna scroll down the discussion box and Q&R after this to read you and try to answer or keep those suggestions and comments in mind. So thank you for your presence today. I'm very grateful for your interest, and hopefully you'll use the framework.